Hello, and welcome to this course on dealing with trauma. Diagnosing post-traumatic stress disorder involves meeting specific criteria set out in widely recognized mental health manuals, such as the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and the ICD-11, International Classification of Diseases. DSM-5 criteria. The DSM-5 requires that a person must have been exposed to a traumatic event, either directly or indirectly, e.g., witnessing the event, learning about a loved one experiencing trauma. Post-traumatic stress disorder is then diagnosed if the individual has persistent symptoms in 4 categories for at least 1 month. 1. Intrusive symptoms. Unwanted and distressing memories, flashbacks, or nightmares. 2. Avoidance. Steering clear of reminders of the trauma, whether that means people, places, or thoughts. 3. Negative mood or cognition. Ongoing negative thoughts or beliefs about oneself or the world, feeling emotionally numb, or having difficulty remembering aspects of the trauma. 4. Hyperarousal. Being constantly on edge, easily startled, or experiencing trouble sleeping. The symptoms must significantly impair daily functioning, such as affecting relationships, work, or overall quality of life. ICD-11 criteria. The ICD-11 is similar, but distinguishes between post-traumatic stress disorder and complex post-traumatic stress disorder, which occurs in people who have experienced prolonged or repeated trauma. The main symptoms align with the DSM-5, but include more emphasis on emotional regulation difficulties and interpersonal issues for complex post-traumatic stress disorder. The diagnosis is based on a combination of clinical observations and self-reported symptoms that fit these categories. Professionals use a range of screening tools to help determine whether someone meets the criteria for post-traumatic stress disorder. These tools provide a structured way to assess the severity and type of symptoms. PTSD checklist for DSM-5, PCL-5. This is a widely used self-report questionnaire where the individual rates the severity of their post-traumatic stress disorder symptoms over the past month. It assesses how much the symptoms are affecting daily life and functioning. Clinician-administered PTSD scale, CAPS-5. This structured interview is conducted by a mental health professional to assess the frequency and intensity of post-traumatic stress disorder symptoms. It involves a detailed discussion of the individual's experiences and how the symptoms have impacted their life. ICD-11 PTSD diagnostic tool. For international use, the ICD-11 criteria are often applied through structured interviews or self-assessment questionnaires to evaluate post-traumatic stress disorder symptoms, especially in cases of complex trauma. These assessments are crucial because they provide a standard way for professionals to evaluate the presence and severity of trauma. They help ensure that the diagnosis is accurate and consistent. If you think you or someone you know might have post-traumatic stress disorder, the first step is usually reaching out to a healthcare provider, such as a general practitioner, psychologist, or psychiatrist. Here's what to expect during the diagnostic process. 1. Initial consultation. This usually involves a discussion of your symptoms, your experiences with trauma, and how these have been affecting your day-to-day life. You may also be asked about your medical history and mental health background. 2. Symptom assessment. The healthcare provider will likely use a screening tool like the PCL-5 or CAPS-5 to evaluate your symptoms. These assessments help identify whether your symptoms match the diagnostic criteria for post-traumatic stress disorder. 3. Clinical interview. A more detailed interview may be conducted, focusing on the traumatic event, the development of symptoms, and how they have evolved over time. The clinician will ask about specific symptoms in relation to intrusive thoughts, avoidance, mood changes, and hyperarousal. 4. Exclusion of other conditions. Post-traumatic stress disorder can sometimes be mistaken for other mental health conditions, such as depression or anxiety disorders, which can have overlapping symptoms. Part of the diagnostic process involves ruling out other conditions that might better explain the symptoms. 5. Diagnosis and next steps. If the criteria are met, the healthcare provider will diagnose post-traumatic stress disorder and work with you to develop a treatment plan. This might involve therapy, medication, or a combination of approaches depending on your specific needs. Important note: diagnosis is just the beginning. Receiving a post-traumatic stress disorder diagnosis can feel like a relief because it provides clarity, but it can also feel overwhelming. It's important to remember that the diagnosis opens up pathways to effective treatment, and with the right support, many people see significant improvement in their symptoms. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.